What is cancer? Cancer is when cells grow out of control and crowd out normal cells. This makes it difficult for the body to work the way it should. In all types of cancers, some of the body's cells begin to divide without stopping and spread into surrounding tissues. Cancer cells acquire the ability to reproduce uncontrollably compared to normal cells, most likely due to a mutation. Let's talk specifically about brain cancer. Primary brain cancer develops from cells within the brain. Primary brain tumors are classified by the type of cell or tissue the tumor affects, the location, and the grade of the tumor. Tumor cells may travel short distances within the brain, but generally won't travel outside of the brain itself. When cancer develops elsewhere in the body and spreads to the brain, it's called a secondary brain tumor, or metastatic brain cancer. Metastatic brain tumors are more common than primary brain tumors. Some cancers that commonly spread to the brain include lung, kidney, and breast cancer. The tumors are categorized by the type of cell in which it first develops. There are over 120 different types of brain tumors. The most common primary brain tumors are called gliomas, which originate in the glial tissue. Symptoms of brain cancer depend on several factors, including the tumor type, size, location, extent, as well as age. Symptoms of brain cancer are influenced by which part of the brain is involved and the functional system it affects. Some common signs of brain cancer include headaches. Having a headache could be related to many causes. A noticeable change in the frequency and intensity of headaches may indicate a brain tumor. Vision changes. A tumor on or near the optical nerve could cause blurred or double vision. Other types of brain tumors may cause abnormal eye movements or changes in vision, depending on the size and the location of the tumor. Other symptoms include weakness, numbness, nausea, vomiting, seizures, change in personalities, and hormonal disorders. Possible risk factors for brain cancer include power lines, mobile phones, hair dye, smoking, and alcohol. A small portion of brain tumors are related to known genetic conditions. People who have one of these rare syndromes have an increased risk of getting a brain tumor. If you have a parent, brother, or sister diagnosed with a brain tumor, your risk is higher than other people in the general population. Some useful prevention of brain cancer could be to avoid exposures to certain environmental agents, eat a healthy diet, include foods high in omega-3 fatty acids such as fish and lean meats, visit your doctor often. Annual physicals are important, especially if you are experiencing abnormal signs or symptoms. Limit or expel your consumption of alcohol. According to the University of Maryland Medical Center, excessive drinking and smoking can lead to the certain diseases that may put a person at risk for cancer. What tests do doctors use to diagnose brain cancer? The initial test is an interview that includes a medical history and physical examination of the person by a healthcare provider. The results of this interaction will determine if other specific tests need to be done. The most frequently used test to detect brain cancer is a CT scan. This test resembles a series of x-rays and is not painful, although sometimes a dye needs to be injected into a vein for better images of some internal brain structures. A treatment plan is individualized for each brain cancer patient. The treatment plan is constructed by the doctors who specialize in brain cancer, and treatments vary widely, depending on the cancer type, brain location, tumor size, patient age, and the patient's general health status. Surgery, radiation therapy, and chemotherapy are the major treatment categories for most brain cancers. Individual treatment plans often include a combination of these treatments. What type of people such as gender, age, and descent are most likely to get brain cancer? Different types of tumors are more likely in different genders, such as meningiomas is almost twice as likely to be found in women than in men, while on the other hand, medulloblastomas is more commonly found in men than women. The age you are most likely to develop brain cancer, if you did, probably would be around age 65 or above. Thank you for watching my presentation. I hope you enjoyed.